Welcome to Mental Health Monday. My name is Mick Coyle. Coming up on the programme this week.
And we know from the conversations we've had with people who've attempted to take their own lives that it's not a case that people want to die. It's a case that they just reach a point where they can't continue living as they are.
A lot of people will be hugely impressed by the amount of work you're putting into this, Steve, but I know how driven you are to get this message out.
Where we know that most suicides are not impulsive in terms of we suddenly decide today we're going to end our lives, and many have been planned for. The actual act itself often becomes that, just things align and it takes place.
And I'll be reminding you how you can make connections with mental health organisations within your community. It's Mental Health Monday.
We're back on the home of the UK's conversation about mental health. Welcome to Mental Health Monday. Thanks for checking us out, your streams and your downloads. Thanks for all your feedback as well for previous episodes. And to everyone checking out the back catalogue of Mental Health Monday, more than 320 episodes that you can listen back to. And also now watch on YouTube. You can kind of listen and watch at the same time. But that's up on YouTube as well, who now host podcasts. So it's been great to get so much feedback from there as well. Cracking conversation on the way today with a guest who's been on the show before, way back, turns out, in 2021. Steve Phillip is our guest. Steve is from the Jordan Legacy. Now, Steve's here on the programme to talk about his son, Jordan, and the legacy that he's trying to create for Jordan. Jordan took his own life at the age of 34, and Steve, ever since, has been doing some amazing work to pull people together and to try and reduce the stigma around suicide, to bring up the conversation, to normalize the conversation about suicide, but also to create a zero suicide society. In the last 12 to 18 months, he's pulled together a guide about how that can actually work, how we can actually try and create frameworks that mean that we deliberately try and get suicide not down by 10% or 20%, but how do we get it down to zero? There's a long way to go to make that a reality. So over the course of the next couple of months, Steve is going on a journey, and he wants to take us on that journey too. So Steve's going to tell us all about the story so far in terms of the Jordan legacy, but also what this next stage of his work is going to be about, which involves a tour across the north of England of some major towns and cities, details of which you can find on the jordanlegacy.com website, as part of his Join the Dots tour. What that's about, it's about getting the conversation around zero suicide out into communities, engaging with people, not just in the academic world, but also within the arts world, in communities, with people like you and me, and that's why he's on the podcast as well. Steve's such a top guy. It's a pleasure to catch up with him. I'm sure we'll hear more from him ahead of the events as well, taking place as part of the Join the Dots tour. But we start off by talking about the fact that in that period since losing Jordan to suicide, Steve must have met some incredible people who he wouldn't have expected to meet and would never have maybe wanted to meet under the circumstances from which they have met. Other families who've lost loved ones, other people who've been horrendously impacted, but actually finding strength, drawing together, and actually trying to find some common good, some common purpose from that shared heartache and that shared trauma. It's a really impressive thing that people are doing, and it's great to see that Steve's doing it.
I think you're absolutely right, mate. In fact, every so often what I do, I think back to some of the conversations I had 2-3 years ago, and people that maybe I've kind of lost touch with on a regular basis now. I think it would be just great to rekindle those conversations. But I remember starting off with a LinkedIn network of probably about 10 or 12,000 people that was considered to be quite a large network at that time. You know, that's grown to 57,000 people that follow me on that platform alone. And the people that I meet, the stories that are shared with me, I always try and engage and respond and get back to them at a personal level, despite the volume that I receive. But just some fascinating, incredible people that are out there, some of them making a real difference in terms of mental health and suicide prevention.
I'm sure many of them are parents who've lost children to suicide who will tell you their stories. And I'm sure each of those stories will be different, but I imagine there are themes that emerge throughout. What has struck you about the correspondence, if you like, that you've had?
Yeah, I think
people.
I said this to someone yesterday. I just kind of thanked them for feeling that they could be so open and share their story with me, which must say maybe something about how we share what we do, that people feel they can be so open. I think what really strikes me is that, you know, when we spoke back in 2021, I was still very early on this journey, as we call it. And a lot of people were kind of reaching out in sympathy to me and offering their condolences, and that still happens, of course. But then there was a point not long after that where I suddenly realized I'd kind of transitioned from being the person that kind of needed the support to the person that was actually then providing the support. I think that was a really interesting time for me. But yeah, constantly people who were worried, particularly parents, about their kids. They're seeing signs. I think they relate to Jordan. He was 34, of course, when he took his own life, but we still consider that to be a young person these days. So I think the fact that when they see Jordan's photograph and his picture, which I share a lot, good-looking lad, ordinary lad, could be anyone's son. I think it really resonates with them. So I think by being able to share Jordan's story in the way we have, it's allowed people to kind of open up and reach out and share their stories and concerns as well.
I think as well what this community of the bereaved families are doing, they're dispelling a lot of the myths around. I mean, you probably remember, Steve, a time where, if somebody's family member took their own life by suicide, the curtains would close for a period of time. They would reopen after a period of time, and then nobody would mention it or dare mention it, and you would be told never ever mention that person had lost someone. And that's not even really one generation ago. That's probably still echoes of that within this current generation. But what I've noticed that I think you did it very recently. I think you posted a to-do list that Jordan had written, which was in his house, which was the most mundane of to-do list, things that I need to do this week. But actually, in sharing that, it certainly made me think, goodness me, there is somebody who, of course, it wasn't it was somebody who had a life and was living, but this darkness came and they weren't able to shake off that darkness. But something like that shopping list, it just showed to me, yeah, these are people. These are people who can be hopefully helped. People who look like you and I. People in our families. People in our friendship groups who might not be showing clues or signs. And for me, that shopping list really sort of just showed that to me.
I've had so many people since I shared that post, just in the last few days, share their own examples of people that were updating their mobile phones, going out for a meal, planning events in the next few days in front of their family, who then, in one case, a young man who was organising something with the family and just went up from the living room to his bedroom and never came down again. Not an inkling that this was going to happen. And I think in those cases, and Jordan's case, and we know from the conversations we've had with people who've attempted to take their own lives, that it's not a case that people want to die. It's a case that they just reach a point where they can't continue living as they are. So these plans, these shopping lists, these events they're planning, they are genuinely planning them. They want to go ahead and pull that restaurant meal. They want to go to the supermarket and buy those toilet rolls and washing up liquid and things that was on Jordan's list and go to the dentist. But battling alongside that is this chronic mental pain that they're going through, or physical pain maybe. And just at a moment, it all combines to be, look, I've considered this. I have a method. I've considered this as a plan. Just now feels the right time. And where we know that most suicides are not impulsive in terms of we suddenly decide today we're going to end our lives, and many have been planned for, the actual act itself often becomes that. Just things align and it takes place.
You said when we last spoke in January of 2021, believe it or not, about creating a legacy and actually using this experience to go and find that way forward. Subsequently, you created the Zero Suicide Society guide, if you like, almost a walkthrough of how we can get to a point where we bring suicide not down by 10% or 7%, or we see numbers kind of like stagnating as they are at the moment, but actually to bring it down to a zero and what those steps could be. And you're taking that message on the road in 2024 with a Join the Dots festival, if you like, over nearly 4 nights worth of conversations, events within communities, very much with people and grassroots at the heart of what you're planning.
Yeah, I think it's really important to understand that, there'll be some fabulous awareness campaigns. We've got to know people like Andy, Mike, and Tim, the 3 dads, really, really well. Fantastic awareness campaigns. One of the challenges we know and documented in different countries as well is that the future impact of awareness campaigns makes some difference, but doesn't make the fundamental change on the ground that you need to see happen. So we looked at the work we were doing in the Jordan Legacy and said that we have to look at how do we introduce practical solutions to prevent suicide, and that's always been our focus. So what we did in 2023, we went out and interviewed many of the people I've just mentioned, like the three dads, heads of Papyrus and Samaritans, the big charities, people working on frontline mental health services, consultants, in fact, anyone impacted professionally or personally by suicide. We asked two questions really through these interviews over several months. One is, do you think we can significantly reduce the number of suicides annually from the 6,000 plus they're at the moment in the UK? If the answer to that question was yes, how far do you think we can go? And we asked them a whole range of other questions. We took that information and published in July, in fact, on July the 11th, 2023, which would have been Jordan's 38th birthday, we published a report called Moving Towards a Zero Suicide Society. Many of the suicide prevention leads around the country called it a groundbreaking report. And effectively, we mapped out all the pieces of the puzzle in society, from our schools, our communities, our workplaces and government, that if you got more to interact and join the dots, in effect, bring them all together and all refer to each other, we could drive those numbers down. Many evidence-based elements of that as well.
Give us a sense, Steve. Give us a sense of just for our listeners, of like one or two things that we could do, changes that could be made in those sort of key institutions that you've just made, that would bring those numbers down.
Yeah. So in terms of government, for example, we had a petition that we launched last year, got over 10,000 signatures for the government to introduce a Suicide Prevention Act and have a national suicide prevention office. Local regional partnerships, for example, around suicide prevention that happen in pockets around the country. Within schools, for example, something the three dads have been pushing for is to have suicide education ingrained in the curriculum in universities. We would have a statutory duty of care in universities to protect students. That doesn't happen across the 400 universities in the UK at the moment. We'd have a suicide-educated and activated public. I think one of the biggest things where we would all learn the very fundamental skills of how to have a conversation and how to spot the signs. We'd look at some of the technology companies and how we could use tech for good to help people that are maybe in crisis or to find them if they're struggling or lost. So many different things we can do in different elements of society that if they kind of all interacted rather than working in silos, as they are now, better access to mental health services, of course, is the big one. All those pieces of the jigsaw. And what we did in this report as well was we left a missing piece deliberately there, a gap in this puzzle. We represent it as a jigsaw puzzle to say, what are all the things we don't know about yet that maybe will come from outside of those working in suicide prevention that could bring in ideas that would lead to this transformational change that we really need to see happen. You know, we show a graph very regularly that shows between the 1980s and 2021 that there has been a real flat line for 16 years now or more, really, in suicide numbers in this country. If anything, they've gone up very slightly at one point. But for 16 years, we've seen no change despite continual national suicide prevention strategies from the government. And now, literally in the last few weeks, we've had the ONS publish their statistics to show there's been a 6% average increase in suicides from 2022 to 23, 8% increase in women, 5% increase in men. Whatever we're doing isn't working.
What struck me about those figures that were sort of, I mean, the figures come out only at the sort of end of each year, but these are the sort of like rounded up figures, if you like. These are the ones. The stat that struck me the most, Steve, out of all of that, the 5,389, whatever the figure was now, it's not necessarily about the numbers, it's about the people. But what struck me was that so many of those suicides which had been registered in 2023 actually took place in 2021 and 2022. And the time at which it was taking to register suicides had increased from 196 days to 203 days, or something very similar to those two. So that, as a numbers man, I would say that if something takes longer to report, the numbers would naturally come down because you're not you're not registering as many because they're taking longer to do. But the reports are taking longer to deliver, and also the numbers are going up. Now that concerns me greatly, Steve, because what that tells me is that the numbers are taking longer to report because there are so many that are having to be dealt with. And actually, once we see a corrected graph, the numbers overall will actually increase on what we currently know, because we know it's more than we're about 8 months behind where that current data sits. And when people talk about, well, why do we need to campaign on this? Or, well, this is the data. We need to know how big this issue is. We need to be talking about how big, in the same way that on during COVID, we'd bring up the graphs of how many people were taken into hospital that day. Mm-hmm. We need to be moving to something that's a little bit closer to real time, don't we? Just to get a sense of what the real picture is out there.
I think you're absolutely right. I mean, I think for a long time, there's been a great sense that suicide numbers are underreported for all kinds of reasons that we probably haven't got time to go into today. We have real-time surveillance now. We've been operating in for the last 2 or 3 years. The police forces particularly have their own system, and we're able to get a handle. And they do tend to correspond fairly closely, in fairness, with coroner's reports. But you're right, coroner's reports can take anywhere from 6 months to 2 years to come through. So by the time you actually get the real figures into the mix, the numbers are likely to be higher, when in fact you wouldn't have expected to see that increase due to the period of time it takes to report them. So it tells you there is a massive issue. We kind of share these figures regularly. It's still the biggest killer of people under 35 years old. Suicide is the biggest killer of men under 50. We're seeing an increase in women suicide now that is concerning. We're seeing an increase in young people taking their own lives now, which is, equally concerning. And I think one thing that can often sound a little crass as well when we talk about this whole ripple effect of suicide is that the human cost is devastating enough. But each suicide, the Samaritans have just brought out a report to say costs the economy £1.45 million. Now, suicide is costing the economy £10 billion a year if we are losing 6,000 plus people a year in the UK. Is that not enough of an incentive for the government to say we should be investing far more than a few £1 million in our healthcare system to deal with this issue? It costs emotionally and it costs financially a huge amount in a way that many other traumatic losses, don't.
Sure. When we talk about, the zero suicide aim, a lot of, for me, and you touched on it there about what we can do is about the normalization of it. You've got the Join the Dots coast to coast festival, if you like, going from Scunthorpe to Liverpool. Decide for yourself if you want your beach holidays there. That's entirely up to you. But coast to coast with events all the way along that M62 corridor, which each of those events in those communities, people will go, oh, what's this about? Oh, it's about this. Oh, are we allowed to talk about this? Oh, it turns out people, there's a music show. There's a theatre opening its doors. There's an event which is taking place about X, Y, Z. There's all these people who are coming into town. Again, it's about normalising it, isn't it? Putting it into people's communities, empowering communities to be able to have a conversation about it.
I think it's really important. I mean, a lot of people say, where is Scunthorpe when we're speaking to them? So we've had to put that on the map for them. But it's interesting, as you say, we're calling it the Join the Dots Tour because it is about joining all those that want to make a difference together. So this is about having the conversation, but it's also taking that report that I mentioned out on the road and showing the practical solutions. It's about all those people that are already introducing practical solutions in each of these towns and cities along the M62 corridor, about demonstrating what they're doing. So, this is what we can do in our communities. The tour starts with this big conference in Scunthorpe on June the 12th with a huge array of speakers. We've got Professor Joe Rafferty, the co-founder of the Zero Suicide Alliance and CEO of Merseycare Healthcare Trust there. We've got people like Julia Waters, who is the sister of Ruth Perry, and that name will be very recognisable as the headmistress that tragically took her own life following an Ofsted inspection that rated her school having been absolutely top to inadequate. to people like Alison Furlong, known to people in the Northwest and Mersey side of the world, be with Alfie's squad. And Alfie was on BBC Breakfast not long ago. He set up Alfie's squad following the loss of his dad to suicide when he was 8. He's 15 now, basically providing support for children between age 6 and 17 who've been bereaved by suicide. These are just 3 of about 20 or 30 high-profile speakers. Mike Palmer from the Three Dads. So the conference kicks it off. We've got this tour of them running across the M62 corridor, tie-ups with charities like Rugby League Cares that are opening up rugby league grounds for us, and taking place on June the 14th between Leeds and Wakefield, Horsforth, where Jordan lived, to Wakefield, where he worked. And then we've got the festival, or the climax of the tour, taking place on June the 22nd and 23rd at the Lock and Key, this incredible outdoor venue where the Bootle Music Festival is held. And people have been amazing. I mean, the people that own that came to us and said they've been following us for years. Can we offer you this for the weekend for free? In North Lincolnshire Council have supported us with the Scunthorpe Conference and said, can we fund this for you? So the support has been absolutely incredible. We're a tiny community interest company made up of 3 of us, and without the collaboration and support of people that we've had, which is what Joining the Dots is all about, we couldn't have possibly got close to, where we are now.
I guess the key question, Steve, is who's it for? For people who would just maybe take an interest or notice that there's an event going on in their local area. Maybe they've not been bereaved by suicide or know nothing about suicide. It's something they can come along to?
Yeah, absolutely. We, on the jordanlegacy.com website, we've got the Join the Dots menu on there and drop-down menus to show what's going on at the festival, the conference, and the tour. These are constantly updated as things are moving fairly rapidly, as you can imagine, with just 8 weeks to go. But who's it for? I think the best way to explain that is to use a line that we use a lot, and that is that anyone can be affected by suicide. Just because you think the family's ticking along and everything's going well, that was our family, for just over 4 years ago. Suicide can affect anyone, but the upside of that is that anyone can prevent suicide. So what we want to do is to say, look, we need this suicide educated and activated public. We need workplaces to be involved. We need education centres to come along, learn more about this topic, which isn't just a mental health issue. Suicide is really caused by many life factors, from the financial crisis to breakdown in relationships to many other factors, all of which most of us are experiencing one or multiple areas of those factors in our lives. So I think this is something for everybody to get educated about, just as you would do with physical first aid. You're more likely to bump into someone who's struggling with their mental health than you are someone who's tripped over on a pavement in front of you and hurt the leg. We need better knowledge. I know that as a parent who was very badly educated. Had I had the knowledge I have now, I would have had very different conversations with my son. And I have to say that had I had those different conversations and had the knowledge, we might not be having this conversation today, Mick. And I really do, mean that.
A lot of people will be hugely impressed by the amount of work you're putting into this, Steve, but I know how driven you are to get this message out. You mentioned the website there. For people who want to find out more information, maybe get involved, maybe find out some more, drop into one of these sessions, take part in the tour. Where can they go?
Yeah, the jordanlegacy.com is the website. Just look for the Join the Dots menu and the drop-down menus that are under there. You'll see everything that's there. I'm going to give a massive shout-out, by the way, to our collaborative partner in crime here, Paul Vittles, who's the tour director, and I'd say out there, I'm speaking to you in Liverpool and all over the place, who has reached out, brought some incredible speakers together, and really brought this whole venture together, really. I'm just kind of chasing to keep up with him at the moment, so I just want to give him a massive shout out.
Just jump on his LinkedIn. He's always on that. You'll spot everything he's up to.
If you don't receive a DM from Paul, then you're not in the right crowd. Yeah.
Steve, just finally, there's a major event, a Zero Suicide Global Summit taking place in Liverpool, literally within days of your arrival, actually on Merseyside as well. Very well timed, by the way. I must say, well done. I'll give Paul the credit for that one. But it just goes to show that this conversation, although this is a very much grassroots, but this is a global conversation taking place around zero suicide.
Yeah, very much. And I think just on this point, we've used the term zero suicide a lot. I think it's really important because it's a term that can get a lot of pushback and a lot of questions. Understandably, people say, hey, you really think you can get rid of all suicide? No, not for one moment. And it's born out of a framework and a philosophy that came out of Detroit in the Henry Ford healthcare systems back in the 2000s with a very successful framework, which then led to the zero suicide global community being created. I think it's really important to understand that most people believe this is the one and only target we should be aiming for. We know that most suicides are preventable. The evidence demonstrates that. We know that every suicide is not preventable. But if we continually aim for zero, then we've got a chance of getting the numbers down from where they are now by 50%, 60% maybe. But if we continually aim, as our government does quite often, for a 10% reduction and target, then that's all we're ever going to achieve. And in fairness, in 16 years, we haven't even achieved that. So we've got to be ambitious with this. And if zero is our goal, if you ask any school, any family, any workplace, how many suicides do you think are acceptable in your location? Without question, each one of them would say nothing is acceptable in terms of a suicide death. They're aiming for is zero.
I've heard many people over many years, Steve, talk about that zero suicide and say, well, you'll never get it to zero. But, let's use a slightly silly analogy of a football team that goes out with a defensive plan not to concede a goal. Occasionally you do concede a goal, but what do you do straight after? You get switched on, you work out why you conceded that goal, and you regroup and you don't try and concede another goal. Now, in the next match, again, you might concede another goal, but eventually those practices come into play. You learn from your mistakes. You start to realize maybe where those weaknesses are that you need to work on, and then you play a game. Then you get a run of games where you get 5 clean sheets. Fantastic, that's brilliant. Now, you might then concede a goal again, but then the process starts again, doesn't it? Well, what's changed? What's different? What do we need to work on? And again, slightly silly analogy, but it does play to that idea that zero suicide isn't a bad idea. It might take a long time to ever really come around, but as a goal and as a strategy, it can be put in place quite quickly.
Yeah, absolutely. And I think it is all about continually learning. We talk about continuous systemic learning through this whole process. That's what the Henry Ford healthcare system did. They got staff involved, they got lived experienced people involved, which are a fundamental part of our whole join the dots strategy here. And they learn from those experiences. And if you continually learn and improve each time you learn, then you will get closer and closer to zero.
Steve, we'll put links to the Join the Dots tour, the festival, Lock and Key, Bootle. I can recommend that. I've been there myself. That's going to be fantastic for you. But all the way through the M62 corridor as well. I think it's going to be absolutely fantastic. We'll be following that journey as well. Steve Phillip, thank you for joining us on Mental Health Monday once again.
Thank you, Mick. Pleasure.
I hope you've enjoyed this week's podcast. Thanks for checking out Mental Health Monday. My name is Mick Coyle. You can find me on Twitter at Mr. Mick Coyle. You can also find me, Mick Coyle, on Facebook as well. Don't forget, if you want to speak to somebody about your mental health, you can do so. The Samaritans, free to call on 116 123. You can find mental health services where you are. Just look for the Hub of Hope. Type in your postcode. It'll find those mental health services close to you. And for support in a crisis, you can text SHOUT to 85258. That's if you're experiencing a personal crisis, you're unable to cope and need support. Shout to 85258. That's a text line. Do get involved in those services. In an absolute emergency, always remember the number to call is 999. Thanks for downloading the podcast this week. We'll be back next week with more Mental Health Monday.